I'm Nicole Griffrath. This is for NUR 400. I'm going to be placing an NG tube, doing medicine through the NG tube, and removing the NG tube. First, I'm going to go in, provide patient privacy. I'm going to wash my hands. I'm going to make sure that I have a doctor's order. I'm going to introduce myself and get the patient's name and date of birth. I'm going to put clean gloves on after I wash my hands. I'm going to make sure their nose is patent, and I'll do that by looking at the pinpoint. I will also look at their past surgery history with their nose, if they have a deviated septum, that they have a intact gag reflex, and that they are their mental status is good enough to be able to cooperate with this procedure. I'm going to put them in high Fowler's position. I'm going to put this towel down. And then I already have my tape and everything ready. I'm going to take this. I'm going to measure from the nose to the ear, to the xiphoid process. And I would tape that to make sure I know how far I can go in. Before I start doing this, I'm just going to let them know that I'm placing an NG tube. It's going to go in through their nose all the way down to their stomach. I'm going to let them know that prior to, or when I first start, I'm going to have their neck hyperextended. And then when I hit their gag reflex, I'm going to have them put their chin to their chest. And then I'm going to have them take sips of water. As they take sips of water, I'm going to insert it 2 to 4 inches and rotating it 180 degrees. I'm also going to lubricate it for about 4 inches, just to make it easier to go down. But for the sake of this video, I'm going to hyperextend the neck just because it's easier for this mannequin. Tape it to there. And then before securing it, I'm first going to make sure they're doing okay with that. And then I'm going to aspirate some fluid contents from the stomach. And I'm going to put it on pH paper. And then I will put that back in. And then I will also listen. I'm going to instill about 20 mils of air. And I'm going to listen over the stomach to see if I can hear it. And then I heard a swoosh. And then also per hospital protocol, I will check with an x-ray depending on the hospital. And then I will go ahead and secure this. This to the gown just to make sure it doesn't rip out. If they do need to be hooked up to suction, or if it's tube feeding, whatever the physician ordered, I will do that. And then I will take my gloves off and document all relevant data, the fringe that I use, how the patient took it, if there was any issues. And then I'm going to do med administration now. So I will do hand hygiene again. I'll put on new gloves. I will make sure that the medication that I am going to be instilling can be crushed. I checked, it can be. I'll make sure they don't have any allergies. If they are on tube feedings, I'll stop that. And then after I do get medication, I will make sure they're not on the suction for at least another 30 minutes. I'll put the pills in there. I'll crush it to be a fine powder. And then I will put it back in there, and then I'll add about 20 mils of sterile water. And then prior to doing it, I'm going to check the placement again, and then I'll also check residual, and then put it back in there. And then I will do my 2 medication administration checks outside of the room, and then when I go in, I'll check their name and date of birth and introduce myself and let them know what I'll be doing. First, I'm going to instill 20 to 30 mils of water. And then I'm going to do the first medication. Trying to alleviate some of the air so they don't have a lot of gas. And another flush, 20 to 30 mils. And if you do make a mess, you can just put a new gallon when they're done. And then the second med. And another flush. And make sure they're doing okay. And like I said, I made a little mess. I could fix their gown. They try to retake this as well. And then I would document all the relevant data, what medications I gave, if they handled it okay. I would not hook up the suction for another 30 minutes just to make sure that medicine's not going to be sucked up right back out. And then I would take my gloves off again, do hand hygiene, and I'm going to be taking the NG tube out. Before I do that, I'd make sure I have a doctor's order. I would listen to bowel sounds. I would make sure that whenever they are clamped from suction or anything, that they aren't having nausea, vomiting. I'd make sure that their tube feeding was undone for about 30 minutes prior. And then I would do hand hygiene. Put my gloves on. Make sure I have some tissues if they need that, some water. If they are going to need oral care after, I can get that ready just to make sure I have it all. And then I will let them know that I'm going to be taking this out. I can check placement again if I need to, just to make sure. And then I will instill 10 mils of sterile air, water, or normal saline. Instill that. And then I will unclamp everything. And then whenever they, kind of going back, but whenever they have their meds, I will also make sure they're sitting up for about 30 minutes after as well. And I'll take all the tape off. And I'll tell the patient to take a deep breath. And then I will pull it out. making sure that it is intact and that didn't disintegrate or parts fell off. I'll take gloves off. I can put more gloves on if I need to. And then if the patient needs oral care, I'll provide oral care, like I said, and tissue if they need to clean anything up, and then if they need a drink or anything. And then after that, I will document how the patient took it, that everything was intact, and document all relevant data.